our live event this lunchtime. We'll be focusing on celebrating Pride Month for this one, and considering and looking at the challenges of visible leadership and how we can be more LGBTQ plus inclusive as a profession. So I'm joined by a panel of pharmacists and pharmacy techs from across the profession who are going to share their experiences, and we're going to consider some questions that we've already kind of pre-populated. But if anyone had any questions that they'd like to ask, please do pop them in the chat box as we're talking, and we can pick them up over the next half an hour or so. So I'd just like to introduce our panel. So Julie, who's a senior lecturer in pharmacy practice. We've got Andrew, who's a senior pharmacist for medicines governance and also a member of our Scottish Pharmacy Board. And we've got Jade, who's a prescribing support technician. And we've got nice GB representation from Wales and Scotland and England, so that's really nice to see. So we know that Pride is a time for us to reflect and look at the progress that we've made with LGBTQ plus equality, but also acknowledging that there's actually so much more to do. And I know from the experiences from people within the profession and also society that, you know, it's something that it can still be a taboo subject or people aren't always comfortable talking about. And so as a profession, we want to move forward with this piece and make sure that there is equality for everybody and that there is visible leadership. And so it's all about the allyship and solidarity, as well as highlighting things that need to be improved. So we just kind of want to discuss a bit of the challenges about visible leadership and why it's so important to have representation across the profession, and what that means in terms of role models for the future pharmacists, and how do we also capture the diversity within the LGBTQ plus community. So I'll start off with my first question, and I'll start off with Julie. Did you want to kind of just introduce yourself, about your background, and also kind of if you wanted to share any of the experiences that you've had across the profession?
Yeah, so I'm Julie. I've been a pharmacist for too many years to count, 25 I think. I stopped counting a while ago. My original background is mainly in primary care pharmacy. I've worked in academia though for the past 20 years, half of that joined as teacher practitioner role and half of it as a full-time academic pharmacist. I live in Halifax, West Yorkshire with my partner Laura. We've been together for 14 years, haven't lost count of that one, even though she has. And we have two kids, two daughters aged 8 and 4. In terms of experiences, I would say that my experiences in the workplace have generally been pretty positive. Although in my current role, it did take me a while to feel comfortable coming out to a wide range of colleagues. I think that when I did so, it was received very positively. I haven't had any adverse comments, adverse reactions, certainly not directly to me. In the wider healthcare system, some of those experiences have been a bit different, particularly related to pregnancy, maternity, antenatal care, that kind of thing, where people have been very confused that I don't have a husband in tow or a husband at home, and that my partner's female, and she had even more confusion. For example, when she knocked on the door of the maternity ward and said, I'm here to see my partner, and they're like, it's father's only visiting hours, I'm afraid you can't come in. She's like, well, you know, I am the legal parent of this child as well, please let me in. So yeah, that's kind of a summary of my experiences so far.
Brilliant, thank you, Julie. That's really interesting, especially the last one from a healthcare professional perspective, and that lack of thinking about that inclusion. Andrew, how about yourself?
Yeah, so I'm Andrew Carruthers. I've been a pharmacist for just about almost 6 years. I'm currently a senior pharmacist for medicines governance, and I am on the Scottish Pharmacy Board, as you said. I currently live in just outside Glasgow with my husband and our dog Toby, who you might hear barking in the background at some point since I'm at home today. My experience has been quite mixed, I think. So in my professional life, I've probably only had 2 people who have been outwardly homophobic to my face, made comments to me, and one person multiple times, so it had to be dealt with, which was quite early on in my career, and I found that quite hard to flex that with trying to be keen and professional, but also obviously really hurt and angry. So I found that quite difficult. What I do notice more of, though, is a lot of people seem to think it's okay to be homophobic about other people or transphobic to me. So I've heard lots of comments about lesbian and bi colleagues. I've heard derogatory comments about other gay men, actually, who are perhaps maybe a bit more effeminate. And I've had plenty of nonsense, particularly recently, about trans people. So I'm always, and I bring this up quite a lot, I'm aware that I come from a point of privilege almost within the community as being a white gay man. I think I have it probably the easiest of all of the people in the LGBTQIA plus community. So I do see it as our duty now to really challenge these behaviours, these comments that are made. So that's why I'm really keen to be involved in this with RPS particularly as well.
Brilliant, thank you, Andrew. And that key bit about allyship, even within the community, is so important, because recognising the diversity within the LGBTQ plus community. And Jade, how about yourself?
Yeah, so I've been a technician for 5 years going on now, but I've worked in pharmacy for about 9 in total across multi-sectors. So I've done community, hospital, production, and I'm currently now in primary care. Myself, in terms of coming up against adversity and things like that, I've not really had any experience directly myself, because I've never felt open enough about myself to actually go telling people things. So I was never going to be open to any sort of discriminatory behaviours or anything like that. I am married to a male, so from the outside I'm in a normal heterosexual relationship with children, although sort of personally that hasn't always been the case. But I've maybe I'm sort of assuming other people's judgments before they make them, but I've always felt that I couldn't actually come out and say these things. In terms of sort of other some of my colleagues who I know who outwardly identify as LGBTQ, I've not known of any negative behaviours myself. A lot of patients I find actually come out with comments that aren't really acceptable, but I've been quite fortunate in that I've not even overheard sort of any negative things where I've been.
No, thank you, Jade. That's a good thing, I suppose, that there's some allyship there, but it's a shame about the patients and that perception, but also touching on that bit about not feeling comfortable, and that's one of the conversations that we wanted to discuss today about, if for people that actually that's quite important, how do we empower them to do that so they feel safe enough to do that within the profession? So I suppose kind of touching on a bit about Andrew, what the point you've made about representation, why is it important to have that representation across the profession? So Andrew, I'll start with you with that one.
Yeah, I think it's important because the profession should be made up of all sorts of people, because it's the same people in the public that we're treating. I think the public want to now see a bit of normality in healthcare. They want to see people that look like them, have similar lifestyles to them, and not all these healthcare robots now that maybe traditionally was the past. They just wanted someone to tell them what to do and what was best for them. I think opening yourself up to patients and colleagues as well makes your job more satisfying. So if you can be yourself within your job, that makes that more satisfying, which is undoubtedly going to make you a better pharmacist and a better clinical practitioner, I think.
Brilliant, thanks, Andrew. And Julie, from your perspective, especially from like an undergraduate perspective as well.
Yeah, so I think I said it took me a while to come out initially in the workplace, and I'm now, I will now, if people ask me questions, I will now answer openly. If people assume that there's a husband behind the scenes, I will correct them that there isn't, in terms of colleagues, and also postgraduate students, postgraduate research students that I supervise. I've only recently decided that I should be more open with our wider student body, our undergraduate students, and I think that that role modelling is important in terms of normalising the diverse spectrum of people that we have in an academic setting, in society, in the pharmacy profession. So yeah, that's a decision that's still a work in progress for me. So I'm gonna work on that over the next year and beyond, and try to be more visible with a wider range of students.
And what you've done so far, Julie, what's been the impact of that?
I think what I've done so far in terms of visibility with students has been relatively small and low key. So it's probably too early really to see what the impact of it's been, but that's certainly something that I want to focus on over the next, like I say, over the next year or so and beyond.
Yeah, brilliant. Thanks, Julie. And Jade, why do you think representation is so important across the profession?
Do you know, I think Andrew's really hit it on the head. I do think that patients will sort of relate a bit better and won't be so scared to approach pharmacists or pharmacy professionals because they'll feel like they can relate to them better. They're more normal. They're not so just clinical. You know, they are real people who can treat you and treat you with care and respect. And say, you know, for example, say that you are somebody who wants to transition to the other gender. You want to be able to know that GPs, pharmacists and things like that are going to be able to understand that and not judge you for it as well.
Yeah, no, thanks, Jade. That patient care is really important. And I know some of the conversations we've had outside of this about being open. So even like having your pronouns in your title is just it's an invitation to someone to say, I understand, you know, even if you're not a trans, but just saying, you know, this is a welcoming space and I kind of get it, is so important, isn't it, for people to feel comfortable to be able to talk to you about stuff like that. So that's really important. And then how do you think we can improve that visibility across the profession of LGBTQ plus community, and like what barriers do you think we should be removing? So Jade, I'll start with you on this one.
Well, it's difficult, isn't it? Because like we've got this inclusion group, but the uptake is still quite poor because I think it is still quite a sensitive subject for people to get on board with and open up with. Sorry, my dogs are moving in the background there. So I think having those conversations is I was about to say breaking down those barriers, but I think they will still be there. So it's going to take a long time, I think. But talking about it, normalizing it almost. I do think we should start with the pre-regs and things, the people who are coming out of university now, so that, you know, going forward, it will become more of a normal thing for them to take. I mean, obviously, it's going to be more difficult for those already working.
Yeah, brilliant. Thanks, Jade. Julie?
Yeah, I think there's something about role modelling here and just trying to create a comfortable environment to enable people to feel like they can be themselves and demonstrate that with colleagues, patients, students, whoever it is, depending on the workplace setting that they're working in. So I think there's some small things that we can do that involve sort of visible symbols of support or inclusion or acceptance. So for example, in my workplace, we have rainbow lanyards. I've not got it on today because I'm working at home, but I brought it as a prop. So, you know, that just kind of indicates to people that you're aware, you're accepting, you're open. And I think, you know, some people have rainbow badges, some workplaces display posters, pride-related posters, particularly significant for this month. Stonewall do a whole range of posters that can be displayed in workplaces or healthcare settings. I know that a number of healthcare settings display posters along those lines as well. And you've talked about use of footers on emails. Yeah, I think those kind of things help to increase visibility and help people to feel accepted or see that acceptance is there in that environment. Yeah, I think they're small gestures, but I think they do really help. They portray a clear message, and in helping to make workplaces and healthcare environments more open and more welcoming to a wider range of people, I think that helps people to feel comfortable in their own skin and be willing to come out as role models.
Yeah, no, thanks, Julie. And Andrew?
Yeah, I think the RPS has done a really good job actually in the past couple of years with Pride. I think they've pitched it really well, how it's been, and obviously they attended events when we could, and I think that's a really good way to almost, well, it's a good way to demonstrate the profession's there, that we were supportive and what the profession could do in terms of the specific needs of the population as well. NHS Scotland has just released their own Pride flag badge for support, and it also has the trans part as well as kind of the Black Lives Matter triangle in it too, which is great. So all-encompassing almost for that. So I think that's good. That, and as Julie said, they're just wee kind of tokens or wee nuggets, but it might open up a conversation, or it might just make someone go, "Oh, it's okay. He's supportive. He's wearing the flag. I can mention my boyfriend or my girlfriend or whatever in that context." I think in terms of barriers that need to be removed, I think we do. It doesn't take much to find things on Twitter about how some people do feel, and I think that we need to be really have open and honest conversations. I think we need to put aside the risk of offending people sometimes, and we need to have conversations and give people an opportunity to ask how do they get things right. I think some people are so scared to even ask that, the fear that they'll offend somebody or whatever. But I think we need to create a space that people can do that. They can make mistakes, and they can be corrected. And I think, for me anyway, if someone is trying to do it correctly, then there's no way that I'm going to be offended by it. But we need to create these spaces to do it.
Yeah. No, thanks, Andrew. That's a really good point. It's about people don't always feel comfortable asking in case they offend somebody. So it's how do you educate yourself, but also create that space where you can ask those questions safely. And I know other things that we've done are like, even just like language is so important. And I know, Julie, you mentioned it in a blog that you wrote for us as well about just thinking about the language that you're using, removing he, she, using they, them, and not things not being implied as being like a heterosexual couple, mother, father, that kind of language, removing that and to be more inclusive. Like, for example, family friendly, is in itself inclusive. So it's how we use that language more. And some hospitals, like in Brighton, they've definitely done a push for that in their documents and stuff like that. And that's some of the work we've been doing with our board paperwork, is just removing that gendered terminology, because it's just, I don't think people realize that they're doing it, but it has a big impact. So things like that as well. But yeah, and that's hopefully like this group that we've created, and obviously people are welcome to join in the ABCD group to have that conversation, because I know one of the discussions we've had is we find like the challenge of people coming forward, like when we're discussing, say, gender or race and disability, people are really forward in joining the reference group or the groups to discuss this. But we find with LGBTQ plus issues that it's a lot more hesitant, and so it's how do we make people feel comfortable about talking about it and broadening that conversation. And then I think that this kind of touches on it, and I suppose things that we've already talked about is being inclusive. So, for example, the rainbow colours and all of that. But there's an element of intersectionality that I suppose we also need to be mindful of and need to consider. And it's how do we ensure that we are having these conversations from an intersectional point of view as well, so that we are being inclusive of people who have other protected characteristics. Julia, I'll come to you with that one. Do you have any thoughts of how we could do that?
Yeah, I think there's something here about just acknowledging and recognising difference, because each and every one of us is different from other people in our own range of ways. And I think that, thinking back to some of the things Andrew said, I think there's a lot of parallels here between what we're talking about in terms of LGBTQ and some of the other things that we've been talking about around equality and diversity, both in RPS, in my own workplace, around ethnicity, race, religion, and just being able to have those open conversations and not making assumptions. So, for example, not making an assumption that somebody of a particular religion will necessarily have had a hard time in coming out with their family, their friends, their community. That may be the case, but it may not be the case. Or conversely, that somebody who has no obvious religion may not have had such a difficult time. So yeah, I think a lot of this comes back to trying to avoid making assumptions or asking questions in a friendly way and wanting to learn more, wanting to understand more. And I would agree with what Andrew said there about if somebody asks me any questions in a way that they're seeking to learn and understand more, then I wouldn't take offence at those questions generally.
Yeah. No, thanks, Julie. And Andrew?
I think what the RPS has done is really good, having the group all together with subgroup, because I think it's important to acknowledge the fact that within the LGBTQ plus community, it's not all rainbows and love and everything. There is a lot of misogyny for the start. There's a lot of racism, I think, as well. There's ableism. So I think we need to look within the different communities as well and almost sort our own things out about why those things exist. So I don't know what that feels like. I know what homophobia feels like. I don't know what racism feels like. I've never experienced that. Probably never will experience that. So I think we need to have people who are at the intersectionality as well to be a bit more, try and get them to the forefront, I think, to discuss it and raise how it is an issue within these areas as well. And hopefully, again, just try and highlight it within the different communities as well, so that we can all come together and support each other would be the best idea.
Yeah, well, thank you. And Jade?
Yeah, I think Julie sort of covered my idea that I was thinking assumptions shouldn't be made with anybody. We should be asking open questions to allow them to explain to us what situation they're in. So she already mentioned, during maternity, it was assumed that a lady coming to the door was in the wrong place almost. So instead of making these assumptions and just saying, no, you're in the wrong place, well, ask why they're there. Things like that, which is quite a simple thing really, but I think we need to retrain ourselves to do it because we're just so used to assuming one or the other. Another way I think that another thing that I think should be added in is sort of values and inclusion sort of training during our like CPD and things like that. The NHS, well, I know in Wales anyway, has already updated their annual reviews to be based around values now rather than actual training. Obviously, it includes that as well, but I think it focuses mainly on your values base. But I think for those who aren't in the NHS, this should also be something for them. So say in their CPD, things like that, I think that there should be values-based and inclusion sort of based training as well.
Yeah, no, that's a really good point about it being focused, and actually then it's mandatory and it's accountable as well. Because I know we were having conversations, we've had discussions with people who suggested maybe one of our revalidation entries could be based around inclusion and diversity or reflective piece, especially with everything that's been going on over the last year or so about how we include that. We've got one question from someone who's listening in about how do we boost true allyship within the profession and not doing it in a non-performative way. So Julie, did you have any ideas of how we could be true allies?
I think one of the things we need to do, and it kind of follows on from what Jade just said, is start these conversations from the very beginning of healthcare professionals' careers. So from the time of their initial education and training, building in more awareness of protected characteristics, more understanding of equality and diversity, a better understanding of cultural competence, and that's certainly something that we're working towards with our undergraduate MFAM curriculum, but I think it applies across the board to all healthcare professionals. And I think that's obviously not a quick fix. It's going to take time to roll that in and get that out there into the profession. But I think it's an appropriate place to start. And I agree with what Jade said about incorporating some of these things into CPD for existing healthcare professionals, pharmacy professionals and other healthcare professionals. One of the things that we're doing in my organisation at the minute, in my School of Pharmacy and Medical Sciences, is we're about to start the annual round of performance development reviews, and we're aiming to have one PDR objective that's linked to equality, diversity and inclusion for each member of staff across the school. It's the first year we're trying to do this. I suspect we will achieve 100% this year, but that's something that we're working towards as well.
Yeah, that'd be really interesting to see how comfortable people feel with that, as well as we touched on having those conversations and going beyond your comfort zone. It'll be interesting to see how that gets taken forward. To hear the feedback on that, but we can afterwards. Jade, how about yourself? How do we make sure our allyship is not just performative but actually meaningful as well?
Yeah, so I mean, obviously we've touched on putting things out there to show that you are open and you are inclusive, like putting your pronouns, wearing rainbow things and things like that. So that on its own, I think, should help other people open up a little bit more and relax a little bit more. But sorry, the dog's walking around again. But in terms of, like, it's difficult, isn't it? Because you'd actually have to action it, wouldn't you, to show that you really do support in a meaningful way. So unless, I suppose, these situations come up, it's difficult to say. You can't actively go out looking for people of various protective characteristics, can you? Just to try and do something about it. Because almost then that's singling them out in the way that you don't want to be. But I think by having those things out there, just as a starting point, if that will open you up then to having more people approach you, then you can sort of implement the way that showing that you actually mean it and, you actually support them and things like that.
Yeah, no, thanks, Jade. And Andrew?
Yeah, I agree pretty much with everything that's been said. I think education at undergraduate level is brilliant for everything, for all protected characteristics. I think something that also would need to be included along with the education part would be about how to challenge it when you see it as well. I think that's the difficult part as well. So people are, especially if they aren't directly affected, it's very easy just to ignore it and think, oh, that person's an idiot, I'll just ignore what they said. But I think by actually, if we can educate our undergraduates on how you would approach those conversations maybe and say, actually, that's not acceptable and here's why, that might help too. Yeah,
that's a good point. And I think it's important that with allyship, I think people sometimes think that it has to happen on a global, in a very visible way, but actually, even if you're just helping one person and being their ally, that is allyship, and being supportive. It doesn't always have to be external or on Twitter or for everyone to see. It could just be someone approaching you and you having an impact and they're able to talk to you. So we're conscious of time and we're coming up to half an hour, so I think this has been a really good starting point for a chat, because obviously these things need to be taken forward and there's always tangible things that we can do, and I think actually there's been some good ideas that people can take away and try and implement. But was there any other final comments anyone wanted to make or raise about this conversation in particular before we draw it to a close? No? I'll take that silence as a no, but we're going to continue this conversation because it is Pride Month for the whole month. We'll be hosting a quiz night on the 24th on next Thursday, so there'll be a registration link going out soon, I think by Friday. So if anyone listening wants to come, please do come, and we'll be carrying on this conversation. And also we are always looking for members as part of this reference group, so if you did want to be part of this and carry on this conversation, please do email us at iand@rpharmacist.com, and we can always have you involved in the conversation. So I just want to say thank you very much to the panel for sharing your experiences and your insights today, and thank you for everybody listening, and we'll see you soon.